Anesthesia is used to reduce sensory and motor function. It's used in inpatient and outpatient surgeries. It is also used to initiate and maintain monitored anesthesia care during diagnostic procedures, and for continuous sedation and control of stress responses in intubated and mechanically ventilated ICU patients. Potency varies directly with lipid solubility. Fat-soluble drugs are stronger than water-soluble. A maintenance of sedation is mechanically ventilated or respiratory controlled ICU patients is 5 to 50 micrograms per kilogram per minute.
Do not take this medication if there is known hypersensitivity to soybean oil, glycerol, egg lecithin, sodium hydroxide, or other components of propofol. May cause urine to turn green. Hypertension is also a concern with this medication. Below are some other adverse effects that could occur while taking this medication. Some states allow nurses to administer propofol as a moderate sedation protocol with mechanical ventilations. Many states prohibit it. Serum lipid levels are to be monitored with long-term use, especially with use of TPN. Nursing staff should always speak and behave as though the patient is completely awake with this type of medication. Ensure a patient is assessed for use of alcohol and tobacco. Also assess their respiratory status, neurofunction, and height and weight to ensure correct dosage calculations. An intervention if the patient becomes hypotensive or bradycardic is to increase their IV fluids, put the patient in Trendelenburg position, and ensure that their airway is patent. These are estimated costs of propofol from 2 different companies.
Dilaudid binds to opioid pain receptors in the brain to reduce pain. This med can be given IV or IM or PO. Dosing depends on doctor. These are the common dosages. This med can be easily addictive. Here are some other adverse reactions to be aware of. This med should not be taken if pregnant or breastfeeding, as well as patients with sleep apnea and paralytic ileus. Do not consume alcohol or other central nervous system depressants such as barbiturates or benzodiazepines with this medication. If toxicity occurs, the patient needs to have naloxone or naltrexone. The cost of the IV med is $144. This medication should only be consumed with a prescription from your provider. If the prescription is not followed, it can lead to serious side effects, even death. If you or your loved ones have questions about these medications, please contact your provider immediately.